Kentucky is second in the nation in the rate of deaths that happen in the first year following childbirth. That's according to the CDC. Lawmakers took action to improve that metric, passing Senate Bill 74, also known as the Momnibus bill. The new law makes pregnancy a qualifying life event for health insurance, which will treat substance use disorders and provide maternity care during and after pregnancy. The state will now be required to keep track of Kentuckians that die during pregnancy or within a year of giving birth, and the path to the governor's desk was not a swift one. The bill went through some changes from the original House version, House Bill 10, to becoming a floor amendment attached to the current bill that ended up passing. Representative Moser, this was legislation that you shepherded through the General Assembly this year. So tell me a bit more about behind the scenes in order to make it happen.
Okay, so Cassie was on this informal work group that I established during the summer, and that's the interim period when lawmakers still come to Frankfort. We work on legislation that we're interested in, and I just started digging down on some data. I think I started hearing some things. Certainly we pay attention to things like the kids data count and or kids count data, and saw that Kentucky's metrics, as you mentioned, were really abysmal on maternal mortality and even infant mortality.
Yeah, 38.4 maternal deaths per 100,000 live births, according to the CDC. To somebody who doesn't understand the data points like that, how bad is that?
Well, I mean, we were number 2 in the nation in rankings, and so I think that puts us on par with probably a third world country. And that is not someplace that we need to be. We need to really understand the why, and that's what we did in this work group. It was bipartisan, bicameral. So that just means that we had folks from both parties on the work group and both chambers. And we came together, I don't know, I think in the beginning it was about once a month, and had a really good conversation, and people zoomed in if they couldn't be there, and we looked at all data points. We started working with Dr. Connie White, who heads up the Kentucky Perinatal Quality Collaborative. She's Deputy Commissioner of the Department of Public Health and a former OBGYN. So very well versed in this topic. And we just started looking at, again, the data points and tried to prioritize what we really thought that we could make a difference on.
Senator Armstrong, you had a seat at the table too. I mean, was there anything that was eye-opening to you throughout this process, or that you took away from it? It's like, wow, this really stuck with me.
Yeah, I am really grateful to Representative Moser for establishing the work group, because what you saw was women legislators coming together, taking a deep dive into the data. We know that 90% of our maternal mortalities in Kentucky are preventable, and we tried to figure out how we prevent those. So we looked at our numbers in our state, at our specific problem. We didn't rely on data from other states, national trends, and I think we did a really good job of fine-tuning and honing in on legislation that really is going to save lives. And it should not be such a standout thing to have people from across the aisle coming together to solve a problem. I worry that it's becoming a really rare thing these days in our current political environments, but I think it was a real bright spot to have people come together and produce an evidence-based bill that everyone could agree is going to help save lives in the state of Kentucky.
Yeah, and I would agree with that. It was a lot of fun. We were able to really have some conversations that were sometimes difficult conversations, and really tried to focus on what we thought we could pass to. We had lots of ideas that didn't get included, but we really followed the data. We discovered, as you mentioned, that pregnancy was not a qualifying life event for health insurance coverage, which is crazy. So we were able to, and through a lot of work with insurers and a lot of discussion, nothing is ever that straightforward, and that was a big piece to be able to get implemented. The other part of the bill that we felt strongly about.
Got about 20 more seconds
left,
yeah,
was establishing the Psychiatric Access Program, the Lifeline for Moms, because we know that postpartum depression is one of the reasons why moms die, and substance use disorders in Kentucky.
Well, we want to thank you ladies both so much for all the hard work on this bill, and I know y'all are pretty proud on it making it to the governor's desk.
Oh, it was huge.
All right.